My name is Raquel Meyer. I have the pleasure of managing one of the Ontario Centres for Learning, Research and Innovation and Long-Term Care. And we are always so pleased to be co-hosting. There we go. So today I am joined by Lisa Sokoloff from Baycrest, who is a speech-language pathologist by training and manages our training and simulation division in ECHO at Baycrest, and as well as Katelynn, Viau, Aelick from the Central Support, our Central Coordinating Office for BSO. So thank you, Katelynn, for joining us. And really today we wanted to give you some great resources that are available and tailored to long-term care, but just want to preface it by saying that indeed there are many sources out there. There are really great sources out there. We could simply not include everything today, but hope that this will be useful to you and add to the resources that you can access as your teams are mobilizing and continuing to ramp up for our next phase of COVID, no doubt. Just a simple statement that our views are our own and not the ministry or the government's. So today we're really interested in how we can share how teams are finding new ways of providing care during COVID and using evidence-informed resources. And we'd like to see how we can be integrating those resources into practice and to support both our existing members of the team, but also the new members of the team. Our teams are looking a little bit different, especially in some homes as we're growing or as we're temporarily taking on new staff to help shore up our staffing levels. And so there are resources out there that are ideal for supporting those processes as you bring people in. All right, we wanted to do our first poll. And so take a moment and think about what new care situations are you encountering when caring for older adults. So as COVID has hit, we've had to think about different ways of doing things. And so what new situations are you encountering?
So Raquel, I'm going to interrupt you for a second just to tell people how to access this. So on your laptop, cell phone, tablet, doesn't matter, go to www.menti.com, and when you get there, put in the code 187129. It should be showing on the screen, and just type in what you want to type in and then hit submit.
So certainly, yes, the use of masks as a regular PPE is certainly an interesting challenge for those of us working in long-term care with our seniors. And yes, reduced interactions for residents. Big challenges with related to visiting and physical distancing requirement. Excellent. Virtual care, more use of OTN, social isolation and anxiety that comes from that. Absolutely. Okay, thank you. Oh, sure. Okay. So today, I think we'll think about those things. I think we're going to hit on some of those topics as they come up. And we've organized this in terms of how you might use the resources as you're working with new team members, any member of the team overall, and also some highlights on resources that are available to leadership in particular. Okay. So let's start with some of the new team member resources that are out there. One of the increases we've also seen is this idea of aides and kind of the universal worker role in terms of volunteers, students coming into long-term care in new ways to provide some of that basic care, trying to free up our team members to do more supportive care. And so on the CLRI website, there is an orientation page that is focused, drills down and really has curated for you some of the key elements you might need and like to have new staff or potential hires reviewing before they come to you or before they start working with residents. So there's a section on foundational knowledge, more around providing support and communicating in long-term care, particularly with residents with dementia. There's information on person-centered care and language and how we get to know a resident. And then we also included, for those aides that sometimes do some very basic personal care, we've also included some resources on oral care, bathing, dressing, and support at mealtime. Now, if your team is coming, if you have new hires that are coming into PSW and nursing roles, we encourage you to go to COVIDCARELE.CA. This is a provincial learning website that emerged at the beginning of COVID in our critical care units in downtown Toronto. I think because of Italy, we were concerned that our critical care units would be the first to be overwhelmed. But in fact, that wasn't the case, and soon the training expanded to acute care staff in Toronto, and it went to the province, and then subsequently they realized they needed to put more support in training long-term care. And so at that point, they invited the Ontario CLRIs and Baycrest to co-lead the development of the long-term care tile, and you can see it there. And it includes more advanced content than what is available on the CLRI website. Perhaps, Lisa, you could put in the code into the chat for us. Would that be okay?
I'm one ahead of you. I already did.
Oh, my goodness.
And don't, everybody, it's capital. The first time you go to the site, you need to register. And the code is capital T RCC 2020 ! And don't forget the exclamation mark. You only need this code the first time. And you can share this code with your healthcare worker friends and colleagues. We only ask that it not be posted on any outward facing websites to the public.
And so, for example, there's the newest section is on environmental services. So if your home is recruiting environmental service workers from school boards, for example, which some homes are doing, and you would like them to get updated training with respect to environmental services in healthcare, we are partnering with the Ontario Healthcare Housekeepers Association, OHHA, and they have freed up some of their training during COVID so that environmental services folks can get up to speed about what that looks like in long-term care. And so thank you to OHHA. We've partnered with many groups in trying to curate resources, and we continue to streamline as best we can. And we're mindful too of the cognitive load that people have when they come to long-term care. They're not just coming because they're caring for one COVID positive resident. They're coming because they're helping shore up our staffing, and they actually have to learn our subspecialty of long-term care. And so this is a great place to do so. It's also great for other sectors. So whether you're going into long-term care, community, hospital, and so on, those sectors are represented on this website. And so it's a great resource if you're being asked to care for somebody who is now COVID positive. Hopefully those numbers are going down. So here again, we've replicated the information for aides and attendants. You'll also find some really good resources for mealtime assistance, PSW nursing, as well as physician and nurse practitioner resources. Coming soon, there will be a long-term care operations section, which will be a resource for leaders as well, in terms of policies and so on. And so just a little deeper dive. into the website. I'm happy to share the slides afterwards, and of course you can register for free, so you can go on and see for yourself. But it includes beyond long-term care fundamentals, also communication and mental health, the environmental services component, some basic mobility, so that if you're an attendant or a volunteer, you might just need basic mobility. Personal care and nursing care include more advanced transfers and so on. There's a section on virtual visits. There's your mealtime assistance piece. And then there's sections on personal care, nursing care, as well as medical and nurse practitioner care. And so we've tried to, through this matrix, give you a sense of, depending on what functions or role you're being asked to fill, you can simply go down, scroll down, and find those appropriate sections in the long-term care tiles. Okay, thank you. All right, so let's go to our next polling question. Here we are. So please go to Menti again and tell us, what new approaches are you trying out to prevent the triggering of personal expressions and responsive behaviors during COVID-19? I know I've heard many challenges around how do you keep people who are interested in wandering secluded. I know that that's a very interesting challenge, for example. So what's new that you're trying? And we would love to, for the group to be able to share some of your success stories, because we all need to replicate those immediately if it's working. So it's menti.com 187129.
Perfect. So far in the chat pod, we're seeing virtual social engagement programming, ensuring that clients are able to recognize staff even when wearing PPE, either through voice or through gentle touch. We'll touch on a few other strategies in the next couple of slides as well. Skype visits, window visits. We've been hearing a ton of innovation related to window visits and look forward to sharing those resources. Making sure to introduce yourself, provision of education, using the principles from the butterfly model, creating pathways to guide individuals away from exits. Perfect. All of this is all very relevant to this next section where we'll be focusing on a number of products and resources related to providing support to individuals who are presenting with responsive behaviors. And Raquel, are you able to bring back up the slides, or do you want me to? Oh, perfect. Thank you so much. So, of course, the COVID-19 pandemic has really changed the look of the environments and the way that we're providing care in those environments, just as everybody was sharing in that polling question. And really early on in the pandemic, many of our team members across sectors were reaching out to us to ask, how can we still meaningfully engage with individuals within all of these various protocols that at that time were just being introduced. So kind of before jumping into the COVID-19 specific documents, there are a couple of foundational resources that, of course, we always need to be keeping in mind related to personhood. So I'm sure to many of you, you've seen a lot of these personhood documents before, but just really wanted to include these as a resource here, as a reminder that more than ever, really knowing a person and what is going to make them feel meaningful meaningfully engaged, what kind of redirection techniques are going to work best with them. Having access to that information is critical more than ever. So we included a couple of resources there, but building upon more of what we were seeing in that polling question about the importance of communication, of ensuring that those that you're caring for recognize who you are. There are a couple of tip sheets that have been developed. One by the Mississauga-Halton BSO team of the Alzheimer's Society of Peel, and the other developed by our partners over at the RGPs, that really provide an overarching review of some of those very key communication strategies to consider while you're wearing PPE. And then moving on to more of those specific resources related to therapeutic engagement. A number of these have been released over the past couple of months from a variety of partners, and I won't read through them all, but once you have personhood tools completed and you're feeling confident with your communication strategies, we really encourage everyone to sift through these documents to really help that spark that creative energy within those newer protocols to better understand how to therapeutically engage with the individuals that you're supporting. So moving on to the next slide. Beyond the provision of the therapeutic engagement ideas, one of the key questions that we received right away, and Raquel touched on this a little bit as well, was a number of our teams reaching out to us to say, how do we support people living with dementia to maintain isolation protocols? So relevant for all team members, whether you're a new team member coming on board or part of the leadership team as well. We have created a resource that considers the need to prevent individuals who are in long-term care or perhaps retirement homes, acute care as well, to remain in their rooms, as well as ways to prevent these individuals from entering other rooms that are on isolation protocols. So again, I won't walk through each of these ideas. However, there are a number of documents and tips and tricks in this area that are available on this tip sheet. The link to it is posted underneath, but we'll also provide a couple of document repositories where you can find all of these great resources. Thank you. So further to this topic area of trying to support individuals to maintain those isolation protocols, there's a group led by Dr. Andrea Iaboni, who have created an ethical guidance toolkit. The toolkit does specifically relate to long-term care within the document. However, there are a number of these documents, there are a number of resources within this toolkit that are of course applicable to other sectors as well. Included in the ethical guidance toolkit are a isolation decision tool, which you can see here on the right, as well as a great care plan template where yourself and your other members of your care team can document which strategies are working well to support individuals to maintain those isolation protocols, and really just provide a very simple way to be able to share that information with others. And further to those individualized strategies, and we saw this as well in some of those poll responses from that second polling question, is the importance of keeping people socially connected during the COVID-19 pandemic. So here we're using the example of long-term care residents and really thinking about all of the individuals that long-term care residents would typically be socially connected to. So beginning here at the top with co-residents. There are a number of ways within the new protocols to support long-term care residents to remain socially connected through some group window visits. We've heard a lot of hallway programming, either hosting a number of games in the hallway, or even just having an hour of where residents can request songs to be played, and having everybody just sit outside of their rooms in long-term care and be able to contribute to that playlist. Secondly, with family and friends outside of the long-term care home, of course, incredibly important to keep residents socially connected to them as well. And we've heard a lot about window visits and the creative ways that people are able to make the most out of those window visiting opportunities. And in addition to window visits, we've heard a lot of our long-term care home partners who have set up general inboxes with a very general email address, whereby family can send letters, which can then be printed off and provided to residents, decorated windowed visits, a number of ways that e-visits can be used, making use of platforms such as Zoom, as well as Skype and FaceTime, making social media posts, letter projects, as well as photo sharing. And of course, on the right side, we also wish to consider how to keep residents socially connected with long-term care team members. So of course, included here, there are some ideas for one-to-one programming. But as mentioned earlier, there have been a lot of opportunities or a lot of idea sharing taking place across the province related to how we can ensure that residents are able to recognize staff members, such as making sure that you are introducing yourself. And we've also seen long-term care homes that have redesigned their name badges to include a photo of themselves, and having that included below their name badge to assist in that recognition. So social connectedness, of course, incredibly important. There is a visits toolkit developed by Family Councils Ontario that's available there, and more to come pertaining to social connectedness. Hopefully in the next few weeks, we'll have more resources and tip sheets released on that topic. As I mentioned earlier, rather than having to sift through this PowerPoint to find all those links again, all of these are available at a number of resource libraries or repositories, one of which being the Brain Exchange and BSO COVID-19 webpage. We're continuing to keep this website or this webpage updated quite frequently, as well as our partners at the RGP of Toronto. I'm sure many of you have seen it. Have a great library as well as webinars, and everything is being recorded and posted there. And on this next slide, lastly, before we turn things over to resources related to leadership, we also wanted to mention that there are a number of resources that are available for team member wellness. And hopefully this screenshot looks familiar to many of you, because there are some wonderful resources available on the CLRI website to support long-term care team members. Of course, they're applicable to staff working across a number of sectors, including the Wellness Together resources, mental health supports, and webinars pertaining to grief and counseling as well. So at this time, I'll turn things over to Lisa to speak about resources pertaining to leadership team members.
Thanks, Katelynn, and thanks, Raquel. Hi, everybody. Thank you for having me here. I'm going to start by speaking about Project ECHO, and I'll just let me back up for one moment and explain for those of you who don't know what Project ECHO is. ECHO is an education program that uses video conferencing to build capacity in primary care providers, and ECHO stands for Extension of Community Healthcare Outcomes. It's a program that was started in New Mexico by one physician, and it's now in something like 37 different countries around the world, with each ECHO program focusing on different areas. ECHO follows a hub and spoke model, which means there's a central site, which is the hub, and then it has spokes, or we refer to our spokes as learning partners. And ECHO works in different ways. Ours generally work as closed cycles, so you join for a certain number of weeks for a certain curricula. Other ones are on a rotating open basis. And the reason I'm saying that is I'm going to explain in the next slide why. One of the biggest pieces about ECHO that we love is that is a multifactorial and multi-directional sharing of knowledge. So we have the learning partners share with the learning partners share with the hub, and the hub team shared back to the learning partners. So, oh, thank you. Also a shout out to Navina Lingam, who is our Project ECHO coordinator, who's doing all the AV stuff and the Menti and moving the slides and everything. So thank you. So the reason I wanted to just put up about the signing up at any time is we run ECHO throughout the year, and we run an ECHO Care of the Elderly program. We're part of ECHO Ontario, which has multiple different ECHOs across the province. And in our ECHO Care of the Elderly, which has been running just over 2 years now, we have 3 different programs. We have general care of the elderly, and then based on need, we started a long-term care focused one, and some of you may have attended, so that's fantastic. And last year in the fall, we piloted a dementia one. The long-term care one we do in partnership with the CLRI, the dementia one we did in partnership with the Alzheimer's Society of Ontario, and the Alzheimer's Society of Toronto participated with us. All of our ECHOs are done in collaboration with a team up in Sudbury at Northeast Specialized Geriatric Center. So a lot of background just to be able to say to you that we were supposed to be doing our care of the elderly, our long-term care of the elderly series right now, and starting in April, and due to the COVID pandemic, we thought, let's focus specifically on COVID-19. So actually, if you don't mind going back one slide, Naveen, I just want to, the dates are up there. We start in April, and we run on Tuesdays from 11 to 12. It's done through Zoom. And this is one where you don't have to sign up for the whole program. So we still have 3 weeks left. So if anybody is interested after this, you can go, there's the link there, which is where we are actually archiving videos and Q&A from each of the COVID-19 long-term care ECHO sessions. And there's also a way to link. Now we can go to the next slide, please. Thank you. So this is just to give you a sample. It's not the most up to date, but for the first 7 sessions. And it's also very telling, as we thought we would start with 4, and this is in partnership with CLRI. And after 2, we thought we better expand from 4 to 8. And after 6, we thought we better expand from 8 to 12. And today was a fantastic session with Ron Riesenbach talking about virtual care and some of the technology ways that we, some of the technology that we're using to actually address a lot of the things that Katelynn was just talking about, in particular the social isolation piece. So again, please feel free to join us. The sessions are going every week still, and we are open to anybody who has an interest in working long-term care. Another important thing that people may or may not know about is there is help out there. We know one of the most pressing issues during COVID is staffing. We know that many long-term care homes have multiple numbers of staff who are off, either sick with COVID or pending testing or for other reasons. And it's really challenging in the ministry. And Raquel, you can jump in at any time if I miss something. Ministry has been supporting, trying to get, for example, nursing students to come work in a PSW role, sort of a win-win for the students and for the home. So there are also these staffing portals where you can connect with any of these organizations and register, and they are keeping also a database, for example, of nursing students or PSWs, and trying to match people, I guess, by postal code, or at least in the area where they would be willing to work. And the long-term care homes appreciate this. I'm sure those of you in long-term care. Now, I know not everybody on this call is in long-term care, and I don't know if any of these, Raquel, would also be portals for people, let's say, who are doing community programs as programs start opening up again. So there would be things to be looking at in your organization. Go ahead, Raquel.
Oh, so I do believe some of the portals are beyond long-term care, so it is a resource for healthcare.
Thank you. Okay, we can go to the next slide, please. There's also what we've been doing really is throwing a lot of resources at you. And as Katelynn said, we've tried to put them all together. And as we go through, you'll see on one slide, we have a whole bunch of links. But also I want to just highlight Advantage Ontario, where there are a lot of recordings and resources there around how to be prepared for the COVID, especially things around communication. And they're posting their recordings there. Some of the key things that we see are popping up across our obviously communication, but also infection prevention and control. Some long-term care homes have the luxury of being affiliated with a hospital like us at Baycrest, where we can tap into our own IPAC, or infection prevention and control. But we know there's a lot of long-term care homes that don't have that. And I know the ministry has been trying to partner, loosely I'll use that word, hospitals and long-term care homes in the area so that they can benefit from connecting. But if you don't have that, here are some great resources where you can look at the recordings about things like PPE and how to wash your hands properly and what type of masks to be using when, and how to basically be ready to manage this. So I'm going to ask the next one. We have another Menti poll. And this is really, it's a quick and dirty ask of your own personal feelings. So what are you doing to, so it's the same Menti and then 187129, it should take you to, but what are you personally doing to prevent feeling overwhelmed? Because I'm looking at the news every day and I'm seeing, here's a great resource and here's a great resource, and people are emailing me all the time, have you seen this? And there's a list of 37 links that I could click on, and I don't know about you, but I don't have time to click on 37 links. So what are you doing to help filter out some of that overwhelming news? So we'll give you a couple minutes to answer. I do find with Menti, when you're doing word cloud, it pops up fast. When you're doing this one, it takes some time, I guess, to process. Limiting your social media use. And we're going to talk about social media in a second as well. Watching shorter segments. Okay, good. Focus on the people. Okay. Limit your access to checking news. Bring things to discuss with your team. A couple people are saying that. So turning to your team, support from coworkers. Yeah. CBC morning update. So maybe having one reliable source. And I emphasize the word reliable because we know there's a lot of stuff out there that, you know, anybody can put anything they want out there these days. So that's great. We'll just go back to the slides. Thank you. So you've shared some good strategies. In particular, I really liked, I liked all of them, but I liked the fact where people were saying, it's important to go to my team, to talk to my team. One of the things we as humans crave is connection. And, you know, when we're talking to our team members as people who have empathy for this situation, we're all in the same boat. And so if we can talk about these things together, that's great. So we did put up a couple of things that have a little bit of evidence behind, some evidence-informed information, things about managing your own personal stress. So really also paying attention to your needs. Are you sleeping well enough? Are you eating properly? Have you put on the COVID-19 like me and everybody else who's you know, baking all the time? All of a sudden during COVID, everybody is turned into a baker. I don't know why. But are you, you know, staying up worrying so you're not sleeping well? Are you, have the boundaries around your work hours changed, especially if you're working from home? Now that you're not commuting, are you keeping your computer on longer? Do you feel like you need to check email all the time as opposed to just when you're at work? What kind of mental health support do you have, or can you have to support other people? Are you getting what you need from your leadership? I think we know that our teams work well together and we support each other. Are you getting the support you need from higher up? Do they understand what you're going through? How is workload being shared? If you are assigned to work with somebody who is COVID positive, do you have the same workload as everybody else? And do you still have to build in all that extra time? Do you have to worry about, oh no, I have to rush through my PPE stuff because I have to get to my next person, or I have to make 3 visits in the community, and how am I going to do that if I can't take transit anymore and I have to drive, or I don't have my car and I have to pay for Uber, those kinds of stress. So it's really important. And there's something else I would add in here that, as I was talking about ECHO, CAMH runs an ECHO program also that is for healthcare providers, that is about dealing with your own personal stress. And if anyone is interested in that, you can connect with me after. I really liked when we asked the question, the poll question, people were talking about limiting your time with the news, limiting your social media, trying to be, look for things that are reliable and disconnect. It's really important to turn off your phone. It's hard for some of us, myself, I'm a self-confessed news junkie, and it's really hard, but I'm trying to do other things like get outside now that the weather is nice. And even taking time, do a little exercise, turn things off a half hour before you go to bed, things like that. If you have kids at home, get into a routine, demonstrate to them what a routine is, because they're going to pick up on what you are going through as well. Okay, the next slide, please. So I just wanted to say a word about social media because I'm a big Twitter person, and my Twitter handle is on the slide with our names on it. And so feel free to follow me. It's a work-related one, so I only tweet about work-related things. And I would say I get a lot of great COVID-related news on Twitter. I find that people are posting articles, and there's reliable people who I follow who are giving good information, but you also have to read everything with a filter. And you need to be able to, I would suggest if you're on Twitter or Facebook or anything like that, that you're very cautious about who you're following and understanding that if they are credible or not, and seeing other people who follow them. But I will say I get more information from Twitter than I do from other places, and it's quite good and quite reputable. So that's just my little hashtag social media. Sorry. So what we've done at the end here is we tried to group, just going back to this is the slide we had at the beginning, and we put the actual links. It's still a lot of links, but at least it can help you if you're thinking of when I'm in my home, I'm going to just speak long-term care for a second, when it's a new team member. It could be new hires. It could also be redeployed staff. And we don't know what's going to happen. We all assume there's a phase 2 coming. Does that mean redeploy in the other direction? Redeploy to, maybe they want more people are going to be able to stay at home in the community, but we have to go out to the community more as things start to open up. Are we going to be, we will have to do things differently when people are coming into clinics, into day programs. How are we going to manage that? How are we going to train staff in different ways? So there's some really great things there for all the team members, everybody together. And then in the leadership, I hope you'd see that when we use the team leadership also very loosely. We're not talking just, directors of care and VPs and managers and directors of programs. We're talking about everybody who in their own way also is a leader. So you may not be someone who's hiring people, but you may be the lead on your team who's in charge of making sure that you've got a buddy system in place for PPE, let's say, to make sure that you and your buddy are putting on the PPE the right way together. So I'm going to open it up for questions. And I'm going to say something now so I don't forget it at the end, and that is, Navina, do you have the SurveyMonkey slide on this version? Okay, so just hang on to that, but we're going to open it up to questions. But at a few minutes to the end, I want to make sure we've been told to make sure we put up a slide for the SurveyMonkey, and that slide will be up for a good 5 minutes after the session, and we'll just put the link in the chat. We would like everybody to please take a minute and fill out the quick survey. So I'll open it up. You can put things in the chat. You can ask questions to any of us directly, and or share your stories. We love to hear stories of what resources people have found and are using. And I can tell you, for example, with the COVID care one and long-term, the CLRI one, we're updating constantly. So if you know of a great resource, please share it with us, because then we'll be able to include it if it's relevant.
In particular, have a success story about something that's gone really well and you'd like to share that with us. I think people would be really keen to hear what's working well in your organizations.
One of our ECHO facilitators, Sid Feldman, always says, I'm very comfortable with silence. I am less so. I'm going to ask a more focused question because I'm wondering, in light of the ECHO session we had today on virtual visits, anybody have stories they'd like to share about what you are doing either in community or in long-term care home to support reducing some social isolation with your clients?
And maybe just to get others thinking, I can share a few things that we've heard from teams across the province, because we recently sent out a survey to our behavioral support teams to help inform the creation of some documents to promote social connectedness, which I alluded to a little bit, that those are coming in the next couple of weeks. And in terms of the virtual visits, we've heard so much innovation. So aside from what was shared in the bullet points in the slides, we've heard that some long-term care homes have developed a schedule. So there are only so many iPads, of course, and iPads certainly make, or tablets in general, certainly make e-visits a lot more portable. So we've heard that some long-term care homes have created a schedule where they have specific neighborhoods or specific units that do virtual visits on Mondays, others on Tuesdays, Wednesdays throughout the week. And then they schedule at family visits within 45-minute increments. Of course, for some residents, 45 minutes would be really quite long. But this way, at least they've found that it's been easier to schedule time with families, so they know exactly when to dial in. And to help on the other side of things with the families that are outside of the home, they've been either hosting little information sessions to be able to show families how to use either Zoom or FaceTime or whichever platform they've been using, and also created little tip sheets about, you know, where to find the mute button and how to turn on your video, and little kind of tip sheets for the tech support side of things. So lots of innovation on the long-term care home side of things, as well as from retirement homes that we've been hearing from our office. Have any others tried creating a schedule or any other innovations related to e-visits?
Hi, everybody. My name is Emily. What we've been doing specifically in the Apotex is getting together with the teams of the clinical liaison, of the e-visit facilitator, of the wellness caller calling the families, and of the therapeutic recreation and coordinator staff, and to gather the most information and share amongst each other so that we have the most value and updates going back to the families. It's not just a generic, what did they participate in? It's something so specific to the point of what they said as a phrase to make the family laugh, so that they feel that we are supporting and showing the best care that we're providing to the residents. It's gone as far as looking forward to birthdays and what are we doing for birthday celebrations in July. And it's supporting them more than they could ever imagine, especially during all of this when they can't see their loved one.
That's wonderful. Thank you for sharing.
This is Ruth Wilford from Thunder Bay, and I work at the Center for Education and Research on Aging and Health. And I thank you for this super information as always. It's just been wonderful. And I appreciate the fact that you say, how are you keeping track of these information, all the websites that you have given us and so diligently update weekly. We on our website in turn then take that information and send it to our database and to the individuals who are working, you know, not only, as Lisa said, in long-term care, but in the community, and we get great feedback on it. But I am working with St. Joseph's Care Group in that they are doing a televisitation program. But our challenge here has been Northern Ontario and the Northern Reserves. So it's great to, lots of their staff has been redeployed to assist with this program. And it's been really interesting in that some individuals, unfortunately, have been in the chronic care of St. Joseph's Care Group for maybe 4 to 6 months and never really had the opportunity to connect with people from their reserve in Northern Ontario. So this has been just wonderful. And then that's been happening. However, that being said, we still have the challenges of equipment. There's been grants that have been written to get iPads, to get them to the communities. There's been lots of behind the scene learning sessions for turning on iPads, making sure that your point, Katelynn, about what schedule, what's going to work and what's not going to work it's been really kind of interesting. But however, the end result has been everybody feeling extremely happy and pleased that these connections have been made. We still have problems with bandwidth and such in the north, but it's happening. So now the biggest challenge is they're not scrambling, but they're working very diligent now to determine how this program is going to continue on, because it's been just very, very beneficial. So I don't know if people out there are in the same situation. I know that they're looking at different funding avenues, or would we be able to continue the program with a robust training of volunteers who could come in and do this? But there's still the unknown, when will volunteers be up and running, allowed to come back in. So it's all those things that accompany these wonderful new opportunities and programs that are happening, but we're just hoping that it can be sustained. So if people have some great ideas how they're going to do that, just send them. We'd love to hear them.
Completely.
Thank you so much. And hi, Ruth. It's so good to see you. One thing Ron was speaking about today is, you know, we know that long-term care overhaul is coming. And this may actually be an opportunity for all of us to advocate for those kinds of programs, for things like making sure there's Wi-Fi available, making sure that there's, you know, affordable equipment available, because we're now demonstrating the effectiveness, I would say, especially in mental health, for these types of visits. So I think that's maybe one way to do it, you know, is to, as this long-term care, I'll use the term reform very loosely too, but as these changes are going to happen, and they are going to happen, that may be a really important piece in there, because I think it's been raised how important the social isolation piece and the mental health and depression piece is.
Yeah, and just to build on what you're saying, Lisa, as well as what you were sharing, Ruth, so many of those innovations for social connectedness that we've been collecting, at the end of their story submission, there are so many teams from across sectors who have submitted, this is working so well, we're just going to try to figure out how we can keep doing this moving forward, even beyond the pandemic, because of course right now we have the limitations in regards to visitors, but there have always been families who've lived at a distance. You know, not all of these challenges are new. So how can we, or how might we be able to explore opportunities to keep these programs running even beyond the pandemic? Definitely happy to brainstorm further and explore how we can get even more creative, because certainly the Wi-Fi issue is something that we're hearing quite a lot, and especially from our retirement home partners. We've had a number of retirement homes who've shared with us that they're really thankful that there's virtual visits available. However, there is no Wi-Fi, and the only kind of wired connection are the 2 computers in the lobby. So, you know, access is certainly a significant issue.
And do you know what, yeah, for sure. And I was a bit remiss here too, because I think, I mean, we are focusing a bit on long-term care, but also there's a program, the Canadian Mental Health Association in Northwestern Ontario, which is located out of Fort Francis, that they did get some of the pandemic funding from United Way and bought 8 iPads. They applied for 16, they bought 8 iPads. They put it in communities like Dryden, Atikokan. I mean, Lisa knows these small little communities. The effectiveness of it is they have gone and they've knocked on Mrs. Smith's door, who they've provided telephone reassurance through this whole pandemic. But they've put the iPad in the mailbox, and Mrs. Smith picks up the phone and they tell her how to turn the iPad on, and she now has a whole new world open to her, that she's getting to actually see people and communicate, and you know, communicate with her family too. So it's working in the community as well. And again, I think when we look at our research projects and what we're doing down the road, you know, years gone by, you would be able to afford hardware within programs, and they're not saying that. I think we're going to have to really advocate for hardware. And I mean, we all know there's all these programs that, I mean, for some of the social isolated seniors here, Telco has put in telephones and given them data plans for like, and I'm not sure how long that's going to happen, or what's going to happen with the phones afterwards. So even within the community, this is working too, and it's opened up a wonderful way of reaching socially isolated seniors. So yeah, great times ahead.
That's great. It also makes me think of something like CABI, the Center for Aging and Brain Health Innovation, and some of the programs that they fund. And I'm not sure what's coming up in the future with them, but, you know, some sort of industry partnership, you know, where you work with Apple or TELUS or Amazon or whoever, and they can perhaps provide some of that as support, some of the devices and whatnot and support, and anyway, just some great things to be thinking of. I was going to share one other thing, actually came up in one of the, oh, sorry, did someone want to speak? Oh, okay. So Navina reminded me of one of our echoes. We were talking about communication and communicating with families. And one of the centers was saying they have weekly town halls, and this could be for long-term care, retirement home, even community-based programs. They have weekly town halls, and what they do is they ask the questions beforehand, and they have one central person who collects all the questions, because they figure, well, if Katelynn's got the question, Raquel and Lisa probably have that same question as well. And they gather all that information beforehand. And so then they have their agenda for their town hall, and then they can also do printed FAQs. And because I think we're sometimes, you know, we're working really hard, all of us, all of you, in making sure also that the families are engaged with the residents or the people living in the community.
Lisa, can I ask a question? It's Rab.
Maybe, sure.
Thank you. So you've been talking, and thank you for a great discussion. You've been talking about tablets and facilitators, and at Baycrest, we're trying to wonder now what happens when we have less and less facilitators and more tablets. So we have been lucky to have access to tablets and units, some through donations. I'm curious if anybody on the call, any institutions have had experience with letting people self-use, self-facilitate, if you will, sessions in our population to do e-visits and social engagement. Is that even possible to imagine solutions that don't require facilitation?
I think the immediate thing that comes to mind in thinking about those that we support across the different sectors is really being mindful of the individual and really having a strong awareness of their capabilities. So I can imagine, you know, for some of the individuals that we're supporting, especially those living in the community, that they would, of course, be able to self-facilitate. But I wonder if there might be some sort of quick tip sheet or assessment to assist in determining when it might work best and what type of support might be needed. Perhaps support is only needed for the setup, and then once the person is set up, the facilitator can then move on. I think that there's some opportunity there to think about that. I don't know, Lisa and Raquel, if you have other ideas on that.
I see that Cindy Kaiser has commented a bit. Do you want to comment on, take off your microphone or take off your mute, Cindy? I don't know if you have a microphone.
Yeah. Okay. And Emily can speak to this too. Emily and I were involved in a research project where we trialed virtual learning. So they were used to getting Ryerson professors in person in groups. And then we did it both in the apex and we went over to the terraces. And even those people in the terraces who tend to be more cognitively, whatever the word is, I don't want to say the wrong word, but maybe more competent with technology, let's say, most of them seem to need quite a bit of support. And, you know, with using internet, whatever, the picture goes out, there's a glitch, they press the wrong button, they lose the screen. So I can just speak to, I believe the majority of the clients at Baycrest, including the terraces, they do need quite a bit support. When we did the research project, we were 1-to-1, so one staff or volunteer per terrace resident.
And I mean, you did see a change in the 6-week period of the course, and when in the very beginning it was, okay, where's the search engine? What do I turn it on? Is it my internet or my email? And you got a couple of the participants when you did do an open recruitment saying, well, would you prefer to email me? And it's definitely interesting to gather that information and see who's a little bit tech savvy and who's not and who's capable of learning that. But the effort that we put into dividing to design a guide to a step-by-step, you know, you lose a little bit of the instructions versus an Android device or a Google device or Chrome or Safari and what you choose to use. But I am hearing more and more in today and what's going on that volunteers aren't able to physically come into some of the buildings, so they have virtual volunteers, and they'll call the family member in advance. They'll call the resident and say, okay, let's walk through it together. Once they're able to start and join the call, then they'll take off. But some residents want a little bit more support and are able to have that volunteer stay for the duration. And it's a learning curve, but slowly this is going to become the new normal and a different way to educate and reach participants. And it's an option that we look at it now and we start seeing the future of what it's going to come down the line. It's going to be beneficial for the volunteer as well as for the resident, where, you know, I look at long-term care and I think that an 80-year-old is young. So it's an opportunity to learn something new.
I just want to make a quick comment. I'm cognizant of the time, but as the telehealth coordinator, I've seen it on both sides. So I've had to walk through instructions with outpatient patients using eVisit, whether it's OTN or Zoom. They are more inclined to learn when someone is with them, either on the phone, walking them through, and just going over the details and telling them how to, what to click and what to do. That being said, it is totally doable with support, and I would not dismiss this for a second because of, you know, whatever situation they're in. It's always doable, and I encourage, I always encourage patients to try it out.
Great. Thank you so much, everyone. We've really enjoyed having you, and thank you for sharing. Please take a moment to fill in the survey, and we'll see you next month. Take good care.
Thank you.
Thank you.
Thank you guys for coordinating.
Thank you, Navina. Thank you, Agnes.